Good morning, everyone. So today we're going to go through some light shoulder mobility, neck mobility, and then get into anterior and posterior core work at the end. So let's go ahead and get started. We're going to start in standing position, going through our crocodile breath assessment. We'll come back at the end and reassess. Standing position for the crocodile breath is going to be significantly different than laying on our back supine for crocodile breath. I want to assess our breath in a lot of different positions because the position we're in is going to be very specific to how our neurology functions. So I want to have a good assessment point for multiple positions: supine, quadruped, sitting, kneeling, half kneeling, standing. So making our big C shapes with our hands, thumbs going in the back, hands above the hip bone, above the crest of the hip, and below the rib cage in that nice meaty space along the abdominal wall. Index fingers are pressing into the front, getting into the front abdominals. Side palm is pressing into the side body, and thumbs are pressing a little bit into that low back. Getting nice inhale. I want to think like a crocodile. We're expanding out in all directions, or like a balloon, that full exhale or inhale. Breath comes forward, out through the side, and into the low back. As we exhale, draw the navel into the spine and cinch the hands a little bit in order to create some resistance for your inhale to press out against. With each inhale, see if you can expand the abdominal walls a little bit wider. Can you start to feel a little bit of a stretch associated with that inhale and that expansion? Like a balloon will stretch. As you put air into it, I want that same sense and feeling around our abdominal wall. And then using your hands as an assessment, notice where do you feel that expansion move easier, more smoothly? Where does it feel like it doesn't move as much? Is it more into the front abdominals? Is it more out to the side, or is it into the low back area? And more importantly, do you feel it more on one side, right side versus left side? Can you breathe better into one side and it's more restricted on the other? If you feel an area where it feels a little restricted, especially if it's like one spot, maybe it's where your thumb is at, you can wiggle that thumb into that spot as you breathe in order to stimulate and then send the intention of that breath into that space. See if you can blow that space out a little bit on that inhale. After a couple more breaths, we're going to go ahead and drop our hands. We're going to pick up a staff. We're going to get a nice shoulder width grip on the staff. This is where I want to imagine that we're trying to bend or break the staff in two. And I want that bend to happen not just at the wrist, but I want to feel it through the elbows. So elbows are spiraling up towards the ceiling. I also want to feel it on the shoulder blades, feeling the shoulder blades pack down on the upper back or the rib cage. And we're going to maintain that active bend in the staff throughout our shoulder mobility. Next, coming back to our breath. Nice inhale in through the belly, exhale, drawing navel into spine. We're going to allow a little bit of tilt of our pelvis. As you inhale into the belly, let the pelvis tilt forward so that we get a little bit of sway in our low back. As you exhale, drawing navel to spine, feel the pelvis scoop a little bit. Notice your glutes tighten up and notice your core lightly engaged. Inhale, goes forward, sway in the back. Exhale, nice scoop. Feel that nice tension in the abdominals in the front on the exhale. On the next one, as we scoop, we're going to continue to breathe, but we're going to maintain this scoop, maintaining the tension in the abdominal core. And at this point, we're slowly bringing elbows up towards the ears, squeezing elbows back as we exhale. Inhale. Let's go ahead and allow the pelvis to tilt forward, filling up the belly into the crocodile or into the sway back, arms coming forward. Exhale, scooping the pelvis at the same time that you're pulling elbows back. See if you can sync the breath. Inhale, big sway in the back, arms coming forward lightly. Exhale, scoop the pelvis. Feel the core engage as you squeeze your elbows back. With each one, see if you can scoop a little bit more at the same time that you're drawing a little bit more back through the elbows. I want to avoid sticking the head out forward. Try to keep the neck soft. The spine is tall. This is a great place to notice. How does this feel around the shoulders on the right side compared to the left side? Is one side a little tighter or a little more difficult to feel that pull, that squeeze? On the next one, as we pull back, squeeze with that scoop of the pelvis, we're going to maintain the scoop of the pelvis. And now we're going to lift shoulder blades up towards the ceiling and drawing the shoulder blades down towards the hips. Exhale as you push. Inhale as you pull. Again, I want to keep the scoop of the pelvis and I want to keep the elbows pulled back at the same time. On the next one, as you reach up, want to keep the shoulders up and elevated, and we're going to come back to drawing the elbows back with our scoop, letting the pelvis tilt forward, sway in the back as we go forward. Drawing elbows back as we scoop on the exhale. Inhale, going forward. We'll let our shoulders down. We're going to move the staff to the behind our backs. Palms are facing backwards, reaching down actively through the elbows. Elbows are actively straight. We're still bending the staff, but we're bending it away from the body. Feel the spiral of the elbows going forward. Notice how that draws the shoulder blades back and opens up the chest to the wall in front. On the exhale, we're lifting elbows up towards the ceiling, squeezing at the top. Inhale, letting them soften down. I want to add the same breath and mobility of the pelvis. So as we inhale, arms are coming down, pelvis is tilting forward, sway in the back. Exhale, lifting elbows up as you scoop. And as you feel that scoop and lift, don't let your shoulders round forward. Try to feel that spiral of the elbows opening up the chest. So the difference is I don't want the front of the shoulder to round forward as we lift. We're spiraling those elbow pits. So that draws the shoulder back and we're maintaining that at the same time that we're lifting and scooping. I'm adding a lot of breath and pelvic work into our shoulder mobility. So this may be challenging from a neurological perspective to get everything synced up together. That's okay. This is one of those things, like bringing these movements in and practicing them on a little bit more regularly over days. It will sync up and become very easy. We're going to flip our palms the opposite direction. Everything else is going to be the same. We're still bending the staff away from the body. So we're feeling those shoulder blades spiraling back and down, opening up the chest. Inhale, sway in the back. Exhale, scoop as we lift. Again, try to keep the head tall, spine tall. I don't want the head or chin jetting out as we lift. If that head jets out, it generally means that our shoulders are rounding forward. So I want to feel that nice tall spine, open, spiraled back shoulders as we lift. Sternum is kind of actively lifting up towards the ceiling as well. And we'll go ahead and set the staff down to the side. We will keep it close because we will come back and use it here in a little bit. We're going to come down to the floor into our quadruped, spreading fingers out nice and wide, grounding palms and extending the elbows fully without locking. If your wrist is a little bit sensitive, then I want to kind of stay back and off of it. I don't want to get into it too deep, but we will move slowly and softly into loading the wrist. Exhale as you move forward. Inhale as you let your hips soften back towards your heels. And I'm going to bring that same pelvic breath into this. As we're rocking back, inhaling, allow your pelvis to tilt down towards the floor, filling up that belly so that we get a nice sway in the low back. And as we move forward, we're exhaling, drawing the navel in and scooping as we load forward into the wrist. We'll keep our reps kind of low at 5 on this, but going nice and slow. Then turning fingers out to the side, we're going to get our nice side-to-side glide with our push and pull. So as I'm moving away from my left palm, I'm pushing that and driving that palm into the floor. As I'm moving into my left palm, I am pulling. Same thing on the right, doing the opposite, push and pull. I want to inhale as our bodies come to center, exhale as we move over the wrist. And then inhale back to center, exhale as we go over the opposite wrist. Notice, where do you feel the tightness and tension in this? Do you feel it more to the thumb side of one wrist? Do you feel it more to the pinky side of the wrist? And is it more on the right or the left? Then we're going to turn our fingers all the way back towards the knees. Closer we come, fingers to our knees, the less intense. The further out we come, the more intense. I don't want this to be super intense. So from here, palms are grounded to the floor. We're going to do our continue with our breath through in pelvic mobility. So inhale, belly opens up to the floor, big sway in the back. Exhale, scoop as you draw your navel in and lightly let your hips sink back to heels. Inhale, rock forward as the belly opens up to the floor. Exhale, navel in as we scoop. Keep the palms grounded. I don't want the palms lifting up off the floor. But I do want this to be soft. I don't want this to be a massive stretch. So if this feels intense, try to back your hands up a little bit more and make the movement a little smaller. And again, I want to go slow with our breath. Then we're going to flip our palms to the back side. Elbows are nice and bent on this. Staying grounded through the back of the palm. We're going to lightly press into the ground through the palm to extend the elbows. I want to feel into that elbow space. Can we feel any stretch? I want to move into the juicy nature of that stretch. How much can you extend into that stretch without turning it into anything over a level 2 in a scale of 0 to 10? I want it to stay in that slight discomfort, not pain. If you're able to fully extend the elbows without stretch and without pain, then we can do a little bit of rocking back hips to heels. At this point, I want to come back to that breath. Sway in the back on the inhale, exhale, scoop of the pelvis. You may notice that by incorporating that mobility of the pelvis into our wrist and shoulder mobility, that it actually added a layer of stretch into what we are feeling. So that would be awesome to get his feedback down in the comments. Let's come off our wrists, get them a little bit of flow back into them. I want to get into our toes next. Tucking the toes, big toe primarily. So turning the heels in towards each other. I want that big toe loaded on the ground, tucked underneath as much as possible. We're going to come right back to that same breath and pelvic movement. Inhale, pelvis tilts forward, opening up the belly to the floor. Exhale, scoop the pelvis. Since our heels are turned in, it's okay to have your knees out a little bit, getting into a little bit of a frog position. Now, as we inhale, filling up the belly, getting that nice scoop. Exhale as you, tilt as scoop on that exhale, drawing the navel into spine and allowing the hips to soften back towards the heels. Inhale as we fill up the belly, getting the sway in the back. Exhale, scoop. I want to see how much are you able to scoop. Start to see if you can feel some stretch in the low back from that exhale and scoop at the same time that you are getting some load and mobility into the big toe joint. I want to make sure we are not moving into pain on the big toe. I want to feel, how does the left side feel compared to the right side? Is the right big toe more mobile? Is one side stiffer, achier, more restricted than the other? If so, can you feel it loosen up and become more similar than dissimilar with about 5 up to 10 slow reps with our breath? Can you feel that stretch start to move into the arch of the foot? Again, is that stretch greater on the right side or the left side? Then we'll bring our knees a little closer together and turn the heels out. I want to see if we can get tucked underneath all the way out to that pinky toe. I know that pinky toe can get hard to get tucked underneath. The more we work on this mobility, the more range of motion we will gain at the toes and the easier this will become, but it will take work, especially if you have a history of wearing shoes, especially stiff shoes or shoes with heels on them. Again, inhale, filling up the belly, pelvis tilts forward. Exhale, drawing navel in as we scoop. Can you feel that light stretch into the low back associated with your breath? And how does this feel at the level of the out of the foot? Specifically the ball of the foot, the lateral ball of the foot. Can you feel the stretch into the outside arch of the foot associated out to the pinky toe? And does it feel greater on the right side or the left side? We'll come back to just heels straight and center, big toe still tucked underneath. We're gonna lightly load into that big toe joint, and now we're gonna do our windshield wipers, letting the heels roll all the way out and all the way in like you're trying to touch them together, and then out like you're trying to touch the heels to the floor. Feel that rolling taking place through all of the toe joints into the midfoot. Again, notice any differences. How does this feel on the right foot compared to the left foot? Especially as you turn the heels in and out. Is there a difference in the quality of the movement on the right leg compared to the left? And we're going to let our ankles go nice and flat to the floor. And we're going to do some simple rock backs, hips to heels, feeling the weight of the hips dropping down to the heels. Can we touch hips to heels? If not, we're working within the range that our knees will allow us to go. Inhale, we're moving forward, filling up that breath into the belly, getting the sway in the back. Exhale, drawing navel in, scooping the pelvis as we allow our hips to sink back towards the heels. Again, I want to see if we feel a little bit of stretch through the low back on that exhale. And then I also want to check in with the front of the ankles. As we're sitting back hips to heels, scooping that pelvis, is there a bigger stretch on the right ankle or the left ankle? Are you able to get your ankles flat to the floor without putting all your weight on them and pressing them down? Or do you feel that there's a little bit of space here that you can't get that ankle to go completely straight? And is it more on the right or on the left? All these little assessment points are going to be helpful or useful in assessing gait mechanic issues and pain issues. All right, so now we're going to change our position. We're going to come into a inverted or reverse sit. Starting with knees bent, palms coming down, grounding to the floor. And we're going to work through some spirals of the elbows. As we spiral the elbows out and away from the body, I want to turn them out. I want that spiral to go all the way up through the shoulder so that you're feeling your shoulders moving back and down like you're pressing into the floor in order to feel that sternum lifting up towards the ceiling. And as we spiral in, we're feeling those shoulder blades round up and over and moving up towards the ears, getting a nice big rounding of the upper back. We're inhaling as we spiral out and press down and lifting the sternum. We are exhaling as we internally spiral, allowing that big rounding of the back. Now, with that action of the shoulders, I want to come back to our same breath. So as we're inhaling, we're filling up that belly and allowing a nice little sway of the back at the same time that we're spiraling out, pressing the shoulder blades down and lifting the sternum. And as we exhale, drawing the navel in, scooping the pelvis as we're rounding the upper back. See if you can feel some of that low back stretch with your exhale with the upper back stretch. Can you feel some stretch between your shoulder blades? Can you feel some stretch down in the low back? And then as we inhale, filling up that abdominals, getting a little bit of sway in the lower back, spiraling out as you press down. Can you feel some stretch across the upper chest as you're grounding down? I want to actively press down through the floor as we're spiraling the elbows out, getting that nice lift through the sternum. On the inhale, exhale, Nice big rounded lower back and upper back. On the next inhale, as you spiral out and away, I want to stay at the top. So we're going to stay in this spiraled out, open-chested position. We need to be able to breathe in this position. So now we're working our inhale and exhale, but we're maintaining downward ground, open chest, bringing some breath into our abdominals, coming back into that crocodile breath. You're going to find it's a little harder and more restricted when we are pressing down through the hands. You can also now change your leg position if you want to go more into a cross leg sit, although you can still stay in this inverted position if you want. So from this position, again, nice, still working crocodile breath. You're going to find that breath is a little easier to get into our lower core. It's going to be harder. It's going to feel restricted up and above because of the way that we are bracing through the upper arms. This is good. I want to be able to breathe down into our lower abdominals when we are braced into the upper core. I also want to be able to do that in the reverse. I want to be able to breathe into the upper core when we are braced through our lower core. And now we're going to bring in some neck mobility. So again, nice grounded palms, open chest, lifted sternum, starting with our blind spots. Looking over the right shoulder, squeezing into it as we exhale. Inhale as the head comes to center. Exhale as we squeeze to the left. Again, I want to go slow and move with our breath. As we're looking over the shoulder, I want to move from the chin. I want to see how far can I move my chin over the edge of the shoulder. I want to make sure that we're not tilting the head from the forehead as we rotate, where we are our head is no longer straight up and down. Moving from the chin kind of helps to keep that elevated head. The more you reach from that chin, you may feel deeper layers of stretch in the neck. How does it feel looking over your left shoulder compared to your right shoulder? Is one direction a little bit tighter, tenser, more restricted? Want to make sure we are not moving into pain. This should not be a painful movement, especially when we're working the neck. We'll come back to center. Now we're going to work lightly tilting one ear towards the shoulder. Opposite ear, we're lifting that ear up and away towards the ceiling. Inhale as we recenter. Exhale as we tilt to the other side and lift. As you're lifting that ear, as you lift your left ear, ground down through your left palm as you're continuing to spiral that elbow out and away. When you inhale, you can soften that palm, going to the other side, lifting the right side. Press down through the palm, spiral that elbow out as you lift that ear up and away. I want to feel that connection pressing down through the palm as we're lifting up through the same side ear. That's going to add a little bit more traction into the lengthening in our neck. Again, I want this to stay soft and juicy, not painful. I don't want to force these movements. This is a nice little explore. And I'm going to add one other layer to this. I'm going to get in a little closer, see if I can cue this in. So imagine I'm grounded down through the palms. I have, when I lift this ear up, I can slightly turn and lift up and forward. I can lift up straight through the center of the skull, or I can reach up more, turning back and reaching up through the posterior. All three are lifting up. All three are slightly drawing in the chin naturally, but they're moving just a little bit different angles through the neck as far as the vectors of these angles. So as you're reaching, reach a little forward on both sides, straight through the center, and a little bit back in posterior. Doing that, I will be curious if you feel any differences in one of those three angles on the right side compared to the left side. If you're feeling something that feels like you're getting into something new, spend a little time there. Give it some reps on both sides, not just the side that feels tight. I want to go back and forth from one side to the other. And if you found that to be too quick or difficult, or you're having trouble understanding exactly what I'm talking about on that, send me a comment, let me know so I can make something that's a little bit more detailed and easier to follow on that. So next, I want to do a little bit of figure 8 work. So we're going to come back to looking at our blind spot by looking to the left, turning that chin over the ear or over the shoulder. I want to maintain our tension as much as we can with that turn. And we're going to now move our gaze up to the ceiling and then back down to the floor. As I'm looking up and looking down, I'm continuing to squeeze into that rotation. I want to keep that tension of rotation. I'm still reaching my chin over my shoulder. I'm seeing how far down can I get my gaze to go, how far up can I get my gaze to go. And then we're going to go to the other side and do the same thing. Making sure that we're still grounded through palms, spiraled out elbows, packed shoulders, open chest. Get that squeeze as we turn our chin to our shoulder, then letting our gaze move down and then up. Notice if it's easier or harder doing this movement on the right side compared to the left. Is it more restricted? Are you able to keep that chin actively reaching over the shoulder? Or does it feel more challenging and difficult? Then we're going to bring it back to the other side, and now we're going to turn this into figure 8. So turning, checking left blind spot, letting our chin move down towards the floor, gaze moves down, and then from here we are going to go diagonally across to up and away to the right, and then we're going to let our gaze go down, and then we're going to go diagonally across up and away to the left, and then let our gaze go down. And continuing that to make a nice figure 8. As you're looking up and away, again, reach that chin over the shoulder. Keep that chin reaching as you go down and away. And then from here, going diagonal across to up and away, turning with the chin over the shoulder, then diagonal down, or gaze goes down, and then diagonal up and away to the other side. After 5 in one direction, we're going to reverse directions. So now I'm back to left, up and away. From here, I'm going to go right, down and away, diagonal across to down. From down and away, up and away on the right side, and then diagonal down across to left and away. Again, I want to reach with the chin over the shoulder, keeping that chin actively reaching over the shoulder as we gaze goes up and away, and then diagonal across to the other side, reaching from that chin. Notice if this is harder or more restricted on one side in comparison to the other side. And then we'll take a rest on our arms and shoulders. And we're going to get into some half kneeling work. If you have sensitive knees, this is a good place to get an extra blanket or towel or something to roll up so that we can kneel on. We're also going to go ahead and grab our staff. So coming into a half kneeling, the leg that is in back, I want that big toe tucked underneath and lightly loaded, as if we are going to drive off that leg to come into like we're going from a half kneeling into a sprint. I'm not going to make you do that, but I want that toe dug in as if you're prepared to. The staff we just have for balance at the moment. We're going to come back to that breath into our belly and allowing the pelvis to move. Inhale, belly opens up, big sway in the back. Exhale, drawing navel into the spine as we scoop. I want to keep head, shoulders, and hips over the knee. If we have the staff next to us, that staff should go right through each of those spots. Ear, shoulder, hip, knee. And that's not going to change even with our breath. As my breath opens up my belly, pelvis tilts. I got this big sway in the back, but the spine, everything else is still in alignment. As I exhale, scooping, everything's staying here. I'm not lunging forward as I go. See if you can feel that stretch through the front of the hip as you exhale, drawing navel in and scoop into it. Can you feel that load? If you don't have your big toe tucked, you're not going to feel that stretched as much. There's a connection between hip flexors and big toe mobility. That's something I want to make sure we're layering in. Each one, see if you can scoop that pelvis a little bit more, drawing the navel in more. Can you feel a little bit more stretch through that front of the hip? Can you start to feel your glute tighten up a little bit as a contraction as you scoop? Then we're going to switch to the other side and do the same thing. So opposite leg comes forward. Again, still want that knee, hip, shoulder, head all in alignment. Inhale, belly opens up, big sway in the back. Exhale, scoop. See if you feel that stretch through the front of the hip. Make sure that big toe is loaded and grounded. Is the stretch on this side greater or lesser than it was on the other side? Is it harder to get into? Can you feel, as you do a few reps, drawing that navel in, can you feel your glutes start to tighten up, or does it feel less tense? After 5, we're going to switch back to the other side. Now I want to make sure that the staff is in the elevated knee side. So my left knee is up, staff is in my left hand. We're going to start with 5 more of the scoops. Inhale into our belly, sway back, exhale, scoop. Second time around, should be a little bit more mobile. Should be a little bit more range of motion, should feel a little smoother. Once we get to the 5th one, now we're going to add in our reach, our free hand. So inhale, exhale, scoop, drawing navel into spine, and now we're going to reach straight up like we're trying to touch the ceiling. I want to feel that lift up through the abdominal viscera as we're getting as tall as we can. I want to do this, but I want to avoid dropping the opposite shoulder. I don't want to do a side bend through the opposite side of my spine. So we're scooping and reaching. This shoulder will be higher than the other shoulder, but it's higher because we're reaching up, not because we're dropping that opposite shoulder down. Inhale, let the shoulder soften. Open belly breath, sway back, pelvis tilts. Exhale, navel to spine, scoop the pelvis to re-engage that stretch as you reach at the same time. If you can sync this all together, you should feel that first stretch in the front of the hip get drawn upward, moving up into, again, that abdominal viscera all the way up through the fingertips. And then we'll switch and do the same thing on the other side. Again, make sure that big toe is tucked and loaded. Switching the staff as well. Starting with just breath and tilt first. Big sway back, exhale, drawing navel in as we scoop. Again, second time around should be a little bit more mobile, a little bit better movement. If that's not the case, then again, this is a good place to kind of send me a message or schedule a consultation so we can talk about it. And then after 5, on that exhale, we're adding in our reach. Now, if one hip is tighter, this reach is going to feel tighter. You're going to feel more tension moving up into that abdominal viscera or into the low back with that reach. My left hip is tighter. This side feels more restricted. It's harder to get into. Again, make sure you're not dropping that opposite shoulder. Then we're going to switch back to the other side. And now we're going to add in some rotation. So this one's going to get a little bit more challenging, especially if you have balance and vestibular issues. If balance is a concern here, then I would actually rather you do this in a chair. If you're good with balance, we're actually going to use the staff by setting it on top of the shoulders. Front of the shoulders. I want the staff touching the very front aspect of both shoulders. I want to keep it there. The main reason for this is to keep our shoulders square together. We're going to come back to our scoops. Back toe is tucked. As you scoop your pelvis, you're now going to turn at the chest, seeing how much can you turn your chest towards the wall to your side. At the same time that you're scooping into this, you're maintaining this scoop. So you have that first stretch. Now we're drawing that stretch rotationally into the obliques. Squeeze into it. Inhale as you come back to center. Pelvis goes forward, sway back. Exhale, draw navel into spine. Feel that first stretch. And then rotate the thoracic, the shoulders. As we rotate, that staff should stay in contact with the front aspects of both shoulders. If it's coming off of one shoulder, that means you're probably reaching through an arm more and you're not actually rotating through the spine. So I want this to be a spinal rotation, which is why I'm using the staff to help keep our shoulders square. Inhale, nice big open belly, sway back. Exhale, feel that first stretch, and then feel the second one as we rotate. Then we'll switch and do the same thing to the other side. Big inhale, start out with just a couple of scoops to feel that engagement of that first stretch. Nice big open breath on the inhale, sway back, exhale, drawing navel in, and then we can add in our rotation. With each one, see if you can rotate a little bit further. Squeeze into it a little bit more. You may notice some significant core engagement. You might notice the core feels more engaged as you rotate one direction and not as much in the other direction. That's going to be useful information. That's going to tell us that some pretty significant info as far as, do you have good balance in core integration on the right compared to the left? This is all going to be related to our gait mechanics. So imagine you're walking, I got my right leg forward, so this is right leg forward. How does my core engage? It engages a little less well on this side than it does on the other, which means that when I'm in this phase of my gait, stepping out with my right foot, this is a side that I might be more vulnerable or at risk of injury compared to the other side. Having that knowledge gives me things to work on. I need to work on my core on this side in comparison to the other side in order to reduce injury risk. All right, we're going to come into our shin box. We're going to do a couple of, just a little bit of quick shin box work. I want to get into some pigeons in order to get, or some folds in order to get into our glutes. I'm going to use the front shin as our direction that we're reaching to, and I want to keep fingers even and square. Exhale as we reach. Inhale as we bring it back. Exhale, see how far can you reach? How low can you reach your sternum to the floor as you exhale? We're going to do 5 of these with each one, seeing if we can exhale and reach a little further without going into any kind of pinch or pain. I don't want pinch in the hips. I don't want pain. After 5, we're going to transition. So transition can either be our thread or our windshield wiper, or we can do our thread through, lifting up our back leg, spiraling it forward, threading it through, lifting and opening up the front leg and spiraling it back, doing the same. Reach evenly through both fingers, keeping the chest square. Inhale as we come back. Still filling up our crocodile breath on our inhale. Exhale, drawing navel into spine. Notice if it feels tighter on one side compared to the other. As we get to 5, we're going to do our transition back and across. Now we're going to go back and forth. So I'm going to change my my position. Doing the same movement. Nice reach. As we come back, we're going to transition to the other side and do the same thing. This will give us a good sense of comparison for how does the right side feel related to the left side. And after doing a couple back and forth, we're going to start to add a layer to this. So as you're going back and forth, getting comfortable with the movement, noticing the differences on each side, as you reach your arms forward, we're going to start to slide that back leg back. Start with a small slide. It doesn't have to go very far. As you come back up, you're bringing that leg back in. Transition across to the other side. And see if you can get into the same position on the other side. Again, not a big movement. We're not going full out right off the bat. Sliding it all back. Transition across. And with each one, we're going to reach that back leg a little bit further back as we're reaching our fingers evenly forward on our exhale. Go slow on this movement. I want to go slow and smooth. I am less concerned about how far we reach, how big the movement is, I'm more concerned with how smoothly we can transition from one position to the other. The end range doesn't mean anything if our transmission or translation into that position is crap, for lack of a better term. If you do not have good movement quality, it's the poor movement quality that's the problem, not whether you can get into the end range pose. So focus on the quality. How do you transition from one to the other? Do you have good control? Can you slow it down and still be able to do it well? The slower you go, the harder it is going to be to control it. But the slower you go, the better the neurological feedback, the better your neurology is going to get. This is why I say go slow to be smooth and be smooth to go fast. Because once we've got the smooth, then we can apply speed with a little bit more confidence. As you're getting nice and loose, we can start to really open this up. How far back can you reach those toes? How far can you reach those fingers? Nice exhale. We'll finish up the last one. And then we're going to come back up into a nice standing position. And I want to reassess our crocodile breath. So coming back to our C-shaped hands, above the crest of the hip, below the rib cage. Nice inhale, filling up and out. Exhale, drawing navel to spine as we squeeze a little tight. Create that resistance. And get it good, like 5 up to 10 deep breaths. Each breath, see if you can get a little bit more into that space. Again, notice where that breath moves into. You want to squeeze in order to create that resistance so that our inhale presses out evenly. Do you breathe easier into the belly? That's pretty normal. Can you get that expansion into the side body? Can you feel it into your low back? Does it feel better or more restricted than when we started? And go ahead and let your arms relax. Take a couple more nice deep breaths. This time just really inflate, not just that lower core, but let that breath fill up through the ribs, up into the upper chest. Breathe into any tension in the neck and shoulders, and on the exhale, let that stuff just rinse off. You can shake it off, you can roll it out. Inhale, filling up into tension. Exhale, release that tension out through the fingers, out through the legs. Let it move down into the core of the earth.